time do we start now? Yeah, we have around 145 participants as of now, but they are logging in. I think they'll keep joining. So
Yeah,
we'll
I think
start.
we can start.
Yeah, yeah. So good afternoon, everyone, and hope all of you are staying safe and healthy. I welcome you all to this important session on understanding COVID-19 precautions, treatment, recovery, and myths around it, which is also the inaugural session under ICEMA's COVID-19 Expert Talk series. As we all know that the second wave of COVID-19 has hit all of us quite badly, causing health emergencies and sparking fear, frustration, and anxiety all around the country. ICEMA, as an industry association, saw this crisis as an opportunity to serve and extend all its help in whichever manner possible to all its members, companies, and the members and their families in this hour of great difficulty. This session has been organized basically to help us filter out the influx of information about the various aspects of COVID-19 that has been flooding all of us through social media. And now, without taking any further time, because we have a senior panel of doctors who have joined us in spite of their, busy schedule. So I would just like to briefly introduce them to all of you, though we know about, their basic information on the mailer. Uh, First, to introduce Dr. Dinesh Mittal. Uh, First, thank you, Dr. Mittal, for helping to put together this panel. Very important panel, as we can see from the response that we got from the members, that there are a lot of questions floating around in people's mind about this disease, even after a year and a half. Uh, Dr. Mittal has, as we all know, that every hospital, I mean, the healthcare system was not prepared in the country, and all hospitals had limited resources. Then also, every hospital had to design a healthcare system, and Dr. Mittal has been on the forefront of it, designing and planning the healthcare system in the hospitals he's been attached with, so that maximum patients can be taken in and taken care of as is the requirement for the current day. Dr. Alia, Dr. Pooja Alia, being an internist, is at any point of time managing 60 to 70 patients under her in the hospital that she's attached with, of all categories, critical to moderate. So she'll have a lot of practical experiences of managing the patients, and will have a lot of insights to share with us. As we all know that many pandemics had, there have been many viruses earlier as well, but they used to generally, attack different kind of organs. Lungs used to be generally spared, but this time, unfortunately, this virus, attacks the lungs the most, and that's become the critical part of the disease. And here, that's why we have Dr. Bharat Gopal, the specialist and the senior pulmonologist who's been managing very sick patients. So again, welcome, Dr. Gopal. So I'm sure we'll all get very important takeaways with these three experts being on the panel, who we all can understand have managed to be with us with their critical duties, which they are attending all 24/7 nowadays. And before I invite Mr. Sandeep Singh, President ICEMA, for his address, I would also like to place on record my sincere thanks to President, Vice President, and the Governing Council members, quite a few who have joined here today with us. Most of them have joined today, um, uh, for being very supportive and guiding us all to take these important actions to support our members and help our members. I would also like to once again express our sincere gratitude to all doctors, healthcare workers for holding us up and helping us fight this pandemic in this critical hour. I now invite Mr. Sandeep Singh for his comments. Thank you.
Sandeep, you are muted. You might like to just check that.
Yeah. Good afternoon. Thank you, Seema. Thank you very much. Thanks for making all these arrangements. And good afternoon, all dear friends and colleagues. I'm sure all of you are hale and hearty under these testing time. I welcome all of you to this very important session on understanding COVID-19, precaution, treatment, recovery, and myths. This will be, as Seema said, that this will be the first in series of such talks that we hope to put together. As we are all aware that we are all passing through unprecedented time when the entire nation is in the grip of severe wave 2 of COVID-19. Every day we listen to some bad news of dear and near ones, very, very unfortunate. So therefore, it is very important for us in construction equipment industry to come together and work towards supporting our employees, their families, our stakeholders, communities around and society at large. All our member companies have been acting proactively in supporting their staff as well as their stakeholders, as I mentioned, our communities, our friends and peers. In addition, ICEMA as an industry association for construction equipment industry has come together to work towards helping our member companies. We have taken some of the initiatives in this direction. The first of initiative which we took immediately is a substantial contribution made by all our member companies to CII Foundation. And this will be used to source life-saving equipment that will be required in critical situation. A national helpline has been set up wherein free doctor consultation will be provided for ICEMA member company employees, their families, if they are COVID positive or if they need any consultancy. We have also initiated sourcing of a good number of oxygen concentrators, which can be availed free of cost by ICEMA member companies, employees, as and when required. I think one of our member has to mute their mic. Seema, can you just look into it? And region-wise, we have set up COVID-19 task force to support ICEMA members related to the requirement in the regions, whether they are their members and their families. And they themselves are in turn sharing the best practices and information on a daily basis. ICEMA has also, with the objective to provide the right medical advice and clarify doubts around COVID-19, initiated a COVID-19 expert talk series, wherein medical experts help clarify doubts and answer our queries. The first such series is planned today, Understanding COVID-19. And it is my pleasure to welcome the esteemed speakers for the session. Seema has already introduced our Dr. Friend, but once again, I would like to welcome them, Dr. Dinesh Mittal, Dr. Bharat Gopal, and Dr. Pooja Rerias. Thank you, sir. Thanks for joining us today. We are really grateful to you. I also welcome my colleague, Dimitrov, Vice President, ICEMA, and MD, Volvo India. I request everyone to make best use of their expert talk sessions and clarify your doubts or queries around COVID-19. Please also provide your feedback and inputs on the session to ICEMA along with topics so that we can further improve our session, what we are going to hold in future. I once again welcome all of you to Expert Talk session and wish everyone and their family a good health. With this, I would like to now hand over to DK Dimitrov, VP ICEMA, and to carry on with the session. Thanks to all of you once again. Please take care and stay safe. Thank you very much.
Thank you, Sandeep. Thank you very much for the very broad inaugural speech, which gives a wide spread of what all activities ICEMA is taking up on for supporting our members during this very difficult time. First and foremost, before I get to the questions, through the three doctors, Dr. Dinesh Mittal, Dr. Pooja Reddy, and Dr. Bharat Gopal, let me express all our sincere appreciation for the great work the medical fraternity all across the country is doing in this very, very tough and very prolonged period of pandemic. We just recently celebrated the International Nurses Day. I don't think we have seen that kind of emotions that have been pouring in the internet to the medical fraternity during this time. Thanks to all of you for joining us. So let me just start by starting with one question to Dr. Mittal. Thanks, Dr. Mittal, for our discussion yesterday. It really helped me to prepare today. You might like to unmute. So just to start off with, COVID has been around for almost a year. We all have read a bit about it here and there, but it keeps on giving new challenges. So I wanted to ask about broader question. As of today, as we look around medical as a doctor, what is COVID, and how can you demystify the things around these new recent variants that is affecting India in the second wave? And if you could just also add, what is the best way to avoid being affected by COVID?
Good afternoon, everyone, and thanks a lot for inviting all of us for interacting with the ICEMA. At the outset, I want to say that we are overwhelmed by the disease, overwhelmed by the information. And so much of information has been around that it has created confusion. So we have to, as you said, you used a very perfect word for that, demystify. That is what is need to be done. It's a simple viral disease coming from coronavirus. Coronavirus has been always there. We have given, this is now known as Corona-19 or COVID-2, whatever you may call it. The names may be different, but coronavirus has been always there. And it is called because the virus has some kind of spikes on its surfaces, which resemble the crown. It has actually taken the crown for all diseases of this, probably the century. So as you put it, how much of virus do we think is there in the entire world? Not more than a tablespoonful. So this is a nuclear war we are actually fighting. And just like in nuclear war, the culprit is a very subatomic particle. Similarly, over here, this is a very, very small particle, but creating very, very big problems. The virus is very happy staying in the upper respiratory tracts, what we commonly known as the nose, the throat. And the portal of entry is the mouth, the nose, and the throat. And this virus will stick on over there, and from there start the disease process. Whenever anything of that sort happens to human body, whether a viral, bacterial, or any kind of infection comes, the body responds to it. And what is the first response is fever. Body secretes certain what you call chemicals which give you fever, which is a whole lot of them. I will not enumerate them, but simply the response of the body is fever. So the first symptom is fever. And since it is sticking onto the throat, so it immediately alerts all the receptors in the throat. Body takes something foreign has come into the throat. It has to be thrown out. What do you do for throwing it out? You sneeze, you cough, and then you throw out the virus. And there starts the epidemiology of the virus. The virus, once it has come to you through your hands, through the air, and has settled into your throat, now you keep on distributing it. Once it is proliferating rapidly using the energy and the cells of human body itself. Means virus cannot replicate on its own. It requires the cells of the host. Once it has proliferated to a significant number, cough is there, the patient or the index case spreads it to the other people. So if you understand this very simple thing, that we carry the virus on our hands, through our mouth, through our nose, and occasionally through our eyes, very occasionally through our eyes also. So some people recommend protection for that also. If we can stop this transmission of virus, if we can cut off this transmission of virus, the disease will stop. We don't need those expensive injections or those, don't go to that stage. First and foremost, stop it. And what's the best way to stop it? One, you wear a mask. Mask is such a simple thing. It has been around for centuries. It has been worn since 17th century. Mainly for surgical procedure it was used. Now it is for multiple uses. And what kind of a mask? Very simple. Any tightly woven cloth mask is enough. You don't require those fancy masks for normal population. Those fancy masks are reserved for people who are at high risk. Who are high risk? Healthcare workers, doctors, nurses who are working in this. The virus, once the patient expels, can be stopped by by the mask. And what is recommended is this is known as tea towel fabric. Whatever is tea towel fabric, I'm not well aware of what is. You and your people in the industry must be knowing. The tea towel fabric is enough to stop the virus. Means a tightly woven cloth. Any tightly woven cloth in 2 to 3 layers is enough to stop this virus. Number two, as I said, it travels on it sticks onto your hands, and then you take it. You merrily take it to your nose, because everyone touches his nose or face multiple times in a day. So once you are wearing a mask, you are blocking that touching of nose and mouth also. So mask helps there also. Number 3, if there is a patient and he has virus inside his throat, he will not throw it out because there is a mask to prevent. जो अंदर आ गया, that stays inside. Whatever goes out stays outside. So that has to be understood. So mask has multiple level. If there are 2 people in the room, one has the protection by mask. If one is wearing is 70%. If both are wearing is 99%. So as simple as that. So as I said, mask is number 1 thing. Number 2 is now come to the hand hygiene. Why so much insistence on hand hygiene? We will not be able to see the virus with the naked eyes. It is omnipresent. If there is an index case, it is omnipresent. You should assume that. Once you have assumed that, then your hands can take it. So the best is hand hygiene. What is hand hygiene? You keep on washing your hands whenever you come back home. This was the Indian way of living also. Whenever you used to come back from anywhere, you used to wash your face and hands. Similarly, today, washing hands cannot be overemphasized. What's the role of sanitizer? See, if you're traveling in a car, you are in an office, everywhere there's not water or soap to wash the hands. Use a sanitizer. What kind of sanitizer is best? Any sanitizer which has more than 60 to 70% alcohol is enough. These are readily available and should be used liberally. Number 3.
Dr. Mittal, just let me switch to Hindi also for some part of our audience. और
हाँ जी.
एक तो वायरस है, दूसरा है वायरस के अराउंड जो पूरा जो माहौल क्रिएट हो गया, ये फर्स्ट वेव, सेकंड वेव, थर्ड वेव की बातें चल रही है. तो ये पैंडेमिक वेव्स में क्यों होता है और इसका जनरल वेलबींग, सोशल वेलबींग और इमोशनल स्टेट ऑफ ह्यूमंस के ऊपर भी इफेक्ट आ रहा है इसका, क्योंकि इसके बारे में अभी इतना ज्यादा बातें हो रही हैं मीडिया में. तो व्हाट आर योर थॉट्स अराउंड दिस कि ये वेव्स क्यों होते हैं और फिर इसका जो सोसाइटी के ऊपर जो इफेक्ट हो रहा है, मेंटल वेलबींग पे जो इफेक्ट हो रहा है, उसके ऊपर भी थोड़ा बोलिए.
यू लाइक टू आंसर इन हिंदी? देखिए, अगर आप ये सारे सब चीज का जवाब हिस्ट्री में है हमारी. अगर हम हिस्ट्री देखें, मेडिकल हिस्ट्री उठा के देखते हैं, तो ये बीमारी शुरू हुई इन्फ्लुएंजा से. अगर हम इन्फ्लुएंजा को देखें, वो इंडेक्स बीमारी है. वो 3 तरीके से सर्वाइव करती है. वन इज एंडेमिक. एंडेमिक का मतलब तो वो रहती है, कभी किसी को कहीं हो गया कोने में, कभी किसी को हो गया. दैट इज नोन एज एंडेमिक. जब वो बहुत सारे लोगों को हो जाती है एक शहर में या एक मोहल्ले में, तो हम बोलते हैं एपिडेमिक हो गया. और जब वो अक्रॉस बॉर्डर चली जाती है, अक्रॉस ओशियन चली जाती है, तब हम उसको बोलते हैं पेंडेमिक. राइट. सो ये फ्लू से शुरू हुआ था और हर 10 साल पे एक एपिडेमिक 2-4 साल में होता रहता था और हर 10 साल पे एक पेंडेमिक होता था फ्लू का. और लोगों ने फिर धीरे धीरे वैक्सीन बनाई और वो पेंडेमिक्स आर ओवर. बट अगर आप हिस्ट्री उठा के देखें तो हर 10 साल पे फ्लू के वो आए हैं और हजारों लाखों लोग गए हैं उसमें फ्लू में. और आपको रिसेंट मेमोरी में अगर लोगों को याद हो तो H1N1 सिमिलर काइंड ऑफ आया था. सिंगापुर और हांगकांग में ज्यादा उसका इफेक्ट हुआ था, इंडिया में थोड़ा कम हुआ था, पर नेवरदलेस हम लोगों ने काफी केस उसके देखे थे. इसी तरीके से कोरोना वायरस है. कोरोना वायरस जब शुरू हुआ, एक वायरस था, तो वो धीरे 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 वायरस जो होता है ना, इसकी एक समझ लीजिए कि ताकत है. वो क्या करता है, अपने आप को अडॉप्ट करता है. आप भी जैसे कोई होता है ना कि घर में चेंज कर देते हैं, ये ठीक हो, अभी कीप ऑन चेंजिंग, वी कीप ऑन इवॉल्विंग. दिस वायरस कैन इवॉल्व इवन फास्टर. इसके ऊपर सरफेस एंटीजन्स होते हैं जो तेजी से चेंज हो. अब आपने एक वैक्सीन बनाई या आपने एंटीबॉडी बनाए जो उसको सरफेस एंटीजन्स को रिकॉग्नाइज करते हैं. इतना स्मार्ट है एंटीजन्स को चेंज. आई डोंट नो इट इज वाइजेस्ट ऑफ ऑल. वो चेंज कर देते आपको, आपके शरीर में अगर आया आप पहचानोगे नहीं. प्रोटेक्शन के लिए एंटीबॉडी नहीं बनेंगे. जिसको एक बार हो गया वो दोबारा भी हो सकता है. सिमिलरली अब जो वेरिएंट आया B.1.167, this is believed कि this came from somewhere from UK. ये जो वायरस आया है, इसकी ये पिछले वायरस से भी ज्यादा तेज है. पहला वायरस अगर इन्फेक्शन करता था, ये और तेजी से इन्फेक्शन करता है और तेजी से फैलता है. बाकी मोर और लेस बेसिक कैरेक्टर वही है उसका, कोरोना वायरस का ही है. और उसके सरफेस एंटीजन चेंज हो गए हैं, इसलिए उसकी जो पुराने प्रोटेक्टेड थे उनको भी दोबारा कुछ लोगों का इफेक्ट हुआ. जो वैक्सीन बनी थी उसमें भी कुछ लोगों का इफेक्ट हुआ. और बाकी जो बिल्कुल ही अनप्रोटेक्टेड हैं उनमें तो तेजी से चला गया। और सेकेंड वेव क्यों आई? इसके दो कारण है। वन तो एक नया स्ट्रेन को हम ब्लेम कर सकते हैं, बट दैट्स अ स्मॉल रीजन। उसका मेजर रीजन है कि हमने कोविड एप्रोप्रिएट बिहेवियर को त्याग दिया। अगर आप दिल्ली में जो रहते हैं वो लोग सब जानते हैं, मेरे भी मित्र हैं, रिश्तेदार हैं, सब हैं, आई कैन टेल यू, उनका सबका कोविड इनएप्रोप्रिएट बिहेवियर शुरू हो गया था। रेस्टोरेंट्स खुल गए, वहाँ जा रहे हैं, खाना खा रहे हैं, ऑब्वियसली जो खाना खाएंगे तो मास्क नहीं पहना है, वहाँ पे इन्फेक्शन हो रहा है। गोवा के मुझे पता चला था 3 महीने पहले कहीं टिकट ही अवेलेबल नहीं, some of the COVID inappropriate behavior. We are in the middle of हम एक पेंडेमिक के मध्य में थे जब हमने ऐसा बिहेवियर शुरू कर दिया कि भाई बल्ले बल्ले सब कुछ बहुत बढ़िया हो गया, लेट्स लीव एवरीथिंग। दैट वी शुड नॉट हैव डन। We should have maintained COVID appropriate behavior, and my takeaway message to everyone should be COVID appropriate behavior at all times and for times to come. That's very important. ये हमारे MSD को याद रखिए, मास सैनिटाइजेशन एंड डिस्टेंसिंग, दिस शुड गो इनटू आवर जीनोम, बिकॉज जब तक हम इसको नहीं समझेंगे हम कल को फिर वही गलती करेंगे और तीसरी वेव आएगी। और तीसरी वेव को रोकने में वैक्सीन तो काम करेगी, पर अगर हम कोविड एप्रोप्रिएट बिहेवियर करें हम सब अपने आप को बचा सकते हैं। So,
thank you, Dr. Vital. Thanks for that comprehensive answer. I think if I summarize it a bit quickly in English, what you're saying is the most critical reason why 3 waves, because that's how history has proven that it comes in waves, and that's probably a epidemiology of the disease. And then when it comes to the protection, the only protection, as you mentioned, is protection at every individual has to have COVID appropriate behavior, which we need not repeat here. It is very well known: wearing masks, sanitizing yourself, and maintaining social distance. I think this has been repeatedly said. Let me come a little bit more deeper into the disease. I will come to you, Dr. Pooja, now. The COVID-19, the initial symptoms of COVID-19 are very similar to a common cold, or, you have fever, you might have body pain, you might have cough. And then when you, at the current stage, very clear recommendation is if you have any of these symptoms, we must take a test. There is RT-PCR and test. It takes time for the test results to come. But in the meantime, because of this huge awareness level that has grown now among people, there is also this fear that, what if I have got COVID? There is this fear and there is this panic. Maybe that's also unsettling people. How would you be able to tell us, should we differentiate between the symptoms and should we try to look for symptoms, or what is your advice to a patient who is today falling sick with early parts of the symptom of this disease?
Good afternoon. First and foremost, as you very rightly said, there is a huge level of awareness and a lot of information is floating, and hence that has also contributed to the panic. So any patient who comes with any symptoms of fever or even mildest throat infection or even a itching in the throat, invariably people presume it to be COVID. So what patients need to be told, or what we need to convince them, is that every small infection is not COVID. Yes, they need to take their precautions. They need to isolate themselves, watch for fever, watch for other symptoms. But at the same time, they need not panic, because every patient of COVID does not need hospitalization. Only a very small subset with severe to moderate disease are the ones which need hospitalization. Because of the information available, practically everybody is on pulse oximeters, and half the time the calls that you get is that my saturation has gone to 93 or 92, which would have invariably gone with the level of exertion. So our patients need a lot of awareness on the fact that these are the symptoms. You need to watch out for them. Things like fever, mild itching in the throat, maybe some cough. And yes, if it persists for 5 to 7 days, that's the time when they need to be in touch with their physician, keep a check on their oxygen saturation. And if there is a deterioration, then they need to think in terms of going to a hospital rather than panicking.
So how do I know, for example, now there is a lot of information out there about the stages of the disease, somewhere saying, there's the first 6 days and there's the next 6 days, and some even split it by 3 days and then another 4 days or something like that. And then, there's this disease progression, how COVID progresses generally in human body. Of course, so a lot of people are getting recovered at home itself, home isolation and home-based treatment. So if you were to tell us a little bit about what to look for in the few days and what to watch out for after the third day, fourth day, and then when would I know that I need hospitalization?
See, usually, most of the initial symptoms that the patients will come to is they will have some itching in the throat or a sore throat or hoarseness of voice and fever, which is the predominant symptom. And these usually stay for the first 4 or 5 days. Majority of the patients will actually complain that I had a sore throat for the first 2 days, I had fever for the first 2 and 3 days, and this has eventually settled down and I'm feeling fine. By 4th or 5th day, majority would have said that the symptoms have settled or the spike or the severity of the fever has come down. But if we feel that the fever is still persisting to be high grade by day 5 or day 6, and if the patient complains of severe cough, or we have difficulty walking, difficulty completing sentences, a routine activity like going to the bathroom, which I was able to do it initially, but now when I'm doing it, I'm breathless, I'm not able to talk, I'm having difficulty, moving around the house, that's a time of moving around their rooms. That's a time that we need to be cautious that I may be in trouble. And specifically for elderly people or people with comorbidities, they need to be more cautious. But yes, when the first 3 to 4 days are usually milder symptoms, and by 5th or 6th days, if the symptoms are not getting relieved or they're progressing, that's the time they have to watch out or they have to be careful.
Is there any specific sign to look for hospitalization that I would need to start thinking in terms of hospitalization, or would you leave it to the fact that you got to listen to your doctor and then whatever the doctor's advice is, just follow that, or
See, it goes both ways. For example, if the patient, because majority of the patients are being, either on video consultations or teleconsultations. So if the patient is able to tell you that he's having difficulty breathing and the oxygen saturation is falling, it is going below, say majority will tell you it's below 90, it's 88, 90 when I go to the washroom. When I come back and I check, it's dropping to 88, 90. So that is the time they have to communicate with their doctor and get themselves admitted. That's the time when they need help.
so if I'm having a pulse oximeter reading of say 93, 94, and then but then if I do some exertion, so there is something called the 6-minute test which I heard
Yes,
about, where you
yes.
walk for 6 minutes and then you check your pulse oximeter again, and if it has dropped by about 5 points, then it is a cause of concern, and that is something that was told to us. What is your opinion about this method of knowing about your condition?
No, why they had come up with the 6-minute walk test, it was important because most of the people were checking their saturation at rest. So you miss patients who were in this term, which was very apparently put as happy hypoxia, that patients feel comfortable at rest, they check their saturation and they feel everything is all right. But it's only when they walk about or they do the 6 minutes walk test, and then when they note a drop in the saturation. So that's the time that this hypoxia gets unmasked. And this is predominantly in the younger population, because they don't feel the hypoxia till the time the saturation has dropped further. So this does help to do a 6-minute walk test.
Thank you, Dr. Pooja. Let me come to Dr. Bharat here now. And there are so many hospitals around in town, but everybody wants to go to the best hospital in town. And there is tertiary care hospitals, there is second tier hospital, there are nursing homes. For a patient, should he worry which hospital he's ending up going to? I mean, is he or is it right? Is it just that they should try to get whatever best they can, because the treatment may not vary too much, right? What is your advice to a patient in terms of what kind of hospital is right for him?
Okay, firstly, I hope I'm audible.
Yes.
So firstly, a big thanks to all of you for letting me be part of this panel. And as I'll just take away from what Dr. Mittal and Dr. Pooja said, this is not only a pandemic, it's more like an infodemic. This is what I usually believe. There's so much of information, right or wrong, which unfortunately, because we are at home, there is so much time to imbibe it rightly or wrongly. Now, this question about what you asked, I think taking the discussion further from the first two questions you said, you have to understand there are things which are ideal, and then there are things which we are doing today in a case of a pandemic, and also a pandemic with a unexponential surge which we never ever thought. Okay, whatever we did, I think we all know by this time that as a society we have a part to play. We are practically responsible as much for what we are doing, what we are feeling now, because I think the virus does not move. It is the people who move it. And that's what we did for 2 months. We tried our best to move it to all across India, and it was smarter than us. Unfortunately, it was smarter, and we are paying a price. So now coming to the question of what is ideal. So ideal is that if a patient who is at higher risk of developing complications, patients who are elderly, patients who have comorbidities, patients who are more likely to go into severe disease. These are patients originally we thought we should always hospitalize or at least get them into a COVID health center. So that's the level 2 type of center. As of now, the situation which we are faced with, thankfully it is becoming better over last week or so, but what we faced with, there was no choice. We were managing patients at home who should have been in at least a level 2 hospital. So as of now, if a patient who has higher risk of developing complications, I think should have made up his mind by day 5 that which is the hospital he needs to go. As you said, a lot of protocols are already set. A lot of protocols are already given by ICMR, AIMS, and all authorities. We may be tweaking it to our comfort in many hospitals, as Dr. Mittal said. But more or less, most of the hospitals now have set protocols. We know a lot about the disease, and we are still evolving and knowing. We know about that first phase. We know about the second phase. We know the basics of treatment. So any hospital which has basic treatments with a basic infrastructure for oxygen, with maybe non-invasive, I think would cater to majority of moderate patients which will land up there, right? Then you come to a very, very small subset, as Dr. Pooja was saying, the subset actually require ICU care out of total is very, very small. The reason that we felt that this time ICUs were in great shortage was not because of the type of patient, because the patients were getting late into the ICU, because of the total collapse of or exposure or the total health structure becoming exposed, primarily because of the sheer number of cases. I don't believe that anybody in the world could have been prepared for the surge which we felt in Delhi. Right. So the important thing to understand is that we should know who are the patients who are likely to deteriorate. So everybody is not likely to deteriorate. Okay. Which are the patients? So this is for the generalized. You will have one-off things that young people deteriorating and landing up in the hospitals, which is happening now. The numbers are looking again huge because of the sheer number of absolute number of cases. The percentage still will not be more than 10%. Right. So we need to have hospitals, nearby hospitals, hospitals with proper oxygen facilities. And I think the rest of the things can be taken by a good internist. You don't require super specialists. And finally, remember, I think COVID is, I'm a pulmonologist, and howsoever I may say COVID is a pulmonary medicine disease, it is not. It is a systemic disease. What you require is a good background of internal medicine. I feel people who are looking at it in a broad way are able to manage those patients much better than who are only looking at a narrow super specialist point. And I think this is what I tell all my colleagues. It is time that we understand and go back to the basics. Dr. Mittal was telling that these are things which have been there for years, but somehow with the specialization, and we are part of corporate hospitals, the corporate world and the super specialization coming in, somehow we forgot the basics of internal medicine. And this is a very big wake-up call. COVID has got us back to the basics. We are all now practicing what we were taught in our MBBS and MDBS. And I think Dr. Mittal would agree to what I'm saying.
So Dr. Bharat, very well said. You know, I was just thinking about the fact that because of the nature of the pandemic and the exponential numbers that we are seeing today, clearly home care is a very important element here. You know,
correct.
And one of the challenges when it comes to home care is this thing which we have always taken it for granted. Our oxygen, you know, which is in the air, which is sufficient for us to breathe, is no longer available so easily. You know, and what we hear and what we see also is that it is the availability of oxygen. And then in some cases, there is a discussion about this oxygen therapy. There is high flow oxygen treatment therapy. There is, there is this all across newspapers, we see oxygen concentrators. And then there is this ventilation, you know, all these different things that are in some way related to oxygen. And the reality is that at home, oxygen support is really not the commonly available, let's say therapy that you can put at home. So what would you say? You know, how critical is that, we as corporates and as an association, we've also invested in some oxygen concentrator floats so that we can help our members to support them at home if they are unable to get a hospital bed. Do you think that is the right measure that we are taking? And could you also tell a little bit about this oxygen and, how come this is able to solve a large part of the, the oxygen therapy is able to solve?
So I think these are very, very important questions. So let's begin from the first step. The first step you said is home care. So nowhere originally in home care was oxygen a part. Let's be very, very clear. Nowhere across the globe, home care for COVID required oxygen to be at home. Why? Because we even put that marker for SpO2 or pulse oximetry at 94, when we actually know that even 90 above is good enough for survival. Why? Because the type of curve or the physiology behind oxygen is that when it starts going below 90, it just shoots down below 90. It's like a free fall, right? So what we are practicing now, and this year, this last 1.5 months, corporates coming in, people buying oxygen concentrators, hoarding oxygen concentrators, it's primarily because there was a lack of facilities in the hospital. That is the main reason. Today, if I'm seeing my patients on video calls, and what I was seeing a week back, I was telling them, see, you don't have an option, so I'm going to do whatever I can and try to arrange some oxygen somewhere because I expect it to fall. Last 2 days, when you have beds available across, oxygen beds are available, the oxygen things have become more, it has become better, right? So asking a patient to delay and start oxygen at home, it's fine. You start the oxygen at home for a few hours till you are getting a bed. But reaching a place and delaying treatment is causing more harm. Also remember that oxygen itself is a drug. See, we are not understanding that oxygen also is a drug. Once we are using a particular set amount for certain flow, we also have to understand that what are the harms of high flow oxygen. There is something called as oxidative stress and oxidative injury which occur. A lot of patients who take very high flows, they don't understand, and a lot of doctors unfortunately don't understand that what we face in the week 3, 4 in the hospitals are what is oxidative stress of high flow. We have oxygen cell damage which occurs. So it is a very, very fine line between the oxygen as an amrit and oxygen as a poison. So it's a very, very fine line. We all know that 100% oxygen can kill people in certain subsets, especially people who have COPD, patients who have asthmatics, who can actually start retaining carbon dioxide. So it has to be very, very clear that using oxygen at home, A, it has to be under medical guidance. B, it is only as a part of a stopgap emergency. Unfortunately, that emergency lasted for 5 days, last around 15 days by. Today, it may last for 5 hours. So please, through this medium, I want to make it clear to the audience that don't think that, okay, my saturation at 3 liters is fine, it is 91, so it will get better. Oxygen is just buying you time for that all that inflammation which is occurring in the body for rest of the medicines to act. Oxygen itself is just giving you that time so that you don't create a problem because of lack of oxygen. But your steroids, your anticoagulation, your thrombosis preventing drug, all that is the baseline or the pillars on which the treatment is going to be based when patient actually becomes sick. So those are better than at the hospital if available.
Thank you, Dr. Bharat. I think it's very clear that support of oxygen availability is mainly to bridge the gap between home care to hospital.
Absolutely.
Until you get the bed. I think that's all about it. It's for short period duration and not to be, in any case, not to be used without the advice of a doctor. So that would be my summary. So if we just move a little bit beyond oxygen to the medication element, there are these talks about blood clotting. COVID is causing blood clotting. Then there is blood thinners being prescribed. Later part of COVID, there is steroids being prescribed. Then we are hearing about medicine names which is so difficult to even pronounce. Remdesivir was difficult itself. Now we have something called tocilizumab, which I learned yesterday. So these and many of these are new age drugs, not fully or not even fully, let's say, tested and proven, but in some cases, symptomatic or let's say there is some evidence that it does help. So the fear about all of the, and these are very expensive medication, and these are all something that is going to cause families to suffer. And then when these diseases are coming, whole families are getting affected at the same time. So on the medicine side, would you like to give us some advice on the medicine side? What is the why does clotting occur? Because I think there is a lot of this worry about clotting, and even worry about vaccination causing clotting. There is this worry which is going on. What do you say? Why does clotting occur, and is it something to be really worried about?
Whom do you want? You want me to go on?
Should I take this question?
Yes, Dr. Mittal, sorry, I thought I can give it. Please, let's come to you, Dr.
No, you can start talking.
Much broader question. So I will take this question. See, whenever, as I said, once the virus has settled in the human body, this is in the first 5 days, then the more reactions start. And there are two pathways to those reactions. Whenever there is a cut anywhere in the body, you must have seen it seals off on its own, because there is a system known as thrombotic system which comes into play. First platelets come, and then after the platelets, the thrombus formation is there. Similarly, whenever there is an infection, inflammatory process takes over. So what you hear is CRP, Procal, interleukin-6. These are all inflammatory markers. And you hear of D-dimer, ferritin. These are thrombotic markers. So these two systems are getting activated as soon as the virus has established itself in the patient. And you have to fight these two. You ask remdesivir, when to give. See, remdesivir has to be given when the virus is replicating. So when is the time it is replicating? It is the most replicating phase around 4th day to 7th to 8th day. That's the time when we have to use remdesivir, right? And then what is the use of steroids? Steroids are anti-inflammatory drugs. So now we are dealing with two things. One is killing the virus itself. For that you have 2-3 antivirus, of which remdesivir has shown to be of more use. So remdesivir has been used from 4th onwards to 8th day, basically to decrease the viral load. Once the reaction to it as inflammation, you use steroids. That's the role of steroids. And then third part is thrombosis is taking place. That pathway also, this virus has been activating that pathway, causing big thrombus to form in the periphery or in the lungs per se, or causing those peripheral thrombus to migrate to the lungs, causing sudden deaths. We recently lost some celebrities also that they were perfectly fine in the evening, and next morning they were dead. So what was it that caused it death? Most probably they threw a large clot from their limbs or somewhere into the lungs. And as Dr. Bharat said, not everything is pulmonary, not everything is lungs. The clot formed elsewhere and caused damage to the lungs. So we need to use anticoagulation. What is anticoagulation? Anticoagulation is a drug which stops any kind of coagulation. Coagulation has two pathways. One is thrombotic pathway, one is platelet pathway. Normally, if anyone gets a stent for heart or a heart attack, or we give ecosprin, clopidogrel. These drugs are for platelet aggregation, the first part of clotting. But in this virus, it's not the first part of clotting which is more problematic. It's the second part, the major clots. The major clots are formed because of the entire clotting system getting activated. This clotting system can be inhibited using injectables like low molecular weight heparin or heparin. These are injectables, and newer drugs are there which can be given, and there were older drugs also to stop this thrombosis, which can be taken orally in the medical supervision. So we fight the three things at three different levels. Virus, we fight with remdesivir. We fight the inflammation with steroids and the difficult to pronounce ocrelizumab. And then we fight the thrombosis through anticoagulation. These are three limbs of treatment. Rest all is supportive. Fever at the give crocin. If the patient is dehydrated, get fluids. If the patient needs oxygen, give oxygen. These are all supportive therapies, but main line of therapy is three points.
Thank you, Dr. Mittal. Let me request Sandeep Singh to unmute. He wanted to ask a question. Sandeep, please go ahead.
Yeah, I think, thank you very much. We are having very good talk. One of the questions which is there in everybody's mind, in this wave 2, Dr. Saab, we are losing many young people, which was never the case last year. And the second is that we have also seen that this has now traveled to tier 2, tier 3 cities, villages and semi-urban areas where the health infrastructure is not very good. And what are your comments on this? This is one question. Number two, yesterday on COVID Shield, they increased the gap between two jabs from 4 to 6 weeks to 6 to 8 weeks to 8 to 12 weeks. What are your comments on this? These are my two questions. So maybe either of you can take that, either Dr. Bharat or Dr. Mittal, please.
Regarding children, the lesser age group that has been affected, why it has happened, no one knows. See, we as doctors will try to do the postmortem once it comes to that. Why did it happen? It's very difficult for me to answer this. Why even children, small children are affected this time, which were spared last time. So maybe my virus, as I said earlier, has mutated. It has changed its character. Last time, the receptors were good to attack the older people. This time, it is attacking everyone. That's why the number has gone many-fold this time. So that part, and I will request ICEMA to arrange for another meeting with the pediatrician, because there are a whole lot of, that's a totally different group of patients to be managed. Wearing a mask may be very easy for you and me. Try making a child wear a mask and you'll understand. As children have not gone to school for 1 year, and now with children getting affected by COVID, how many more years, I really don't know. So that's a one part. The second part is the disease moving on to tier 2 and tier 3 cities. This is very scary. As a doctor, I will tell you, for someone who has been managing limited resources, I tell you, I am very scared. I was always scared of this. I will be always scared of this. And this is going to be catastrophic unless and until people like you, your industry, steps in and puts voluntary organizations into help. Doctors were not there at all. We already had very high mortalities in villages succumbing to very basic gastroenteritis. We as in India, we are still fighting those basic diseases which the West is long over with. We still have the highest mortalities with gastroenteritis. The patients died during childbirth. So that's my way of putting my healthcare sector into right perspective. And tier 2, tier 3, they don't have any facilities. If they have facilities, there are no people to manage.
Yeah.
And people to manage. A city like Delhi crumbled for oxygen. What will happen to tier 2, tier 3 cities? So the basic thing which will help is something like what Dr. Pooja said. You educate the people. You treat one patient, you have treated one patient. You educate the family, you have educated 7 people. You have treated 7 people. And ask them to spread the message. If everyone in tier 2, tier 3 city is bound with is given some kind of this kind of information. As in the opening remarks, you said that we are opening helplines.
Yeah.
That was something which is very good. I'm from AIMS. Our AIMS group has also set in a helpline along with the media group. We are setting helplines because we know for a daily person it's very easy to catch hold of a doctor. Even for a person in Noida, it may be okay. But come to the semi-urban belt, or you come to cities like Panipat, Sonipat, doctors are there, but very few. So it will be very, very difficult. And as you rightly said, instead of showing our media has a responsibility, our industry has a responsibility towards that. If industry creates helplines, if media creates, the first time today, one of the media groups has created a helpline. That helpline should have been created a month back. I've been after them. Create a helpline. This will go a long way. One helpline can save, I'm telling you, thousands of lives. So as you said right in the beginning, I was very impressed that you have also created a helpline and have doctors. It's a force multiplier.
Yeah.
A doctor cannot go to the village, but village can come to the doctor.
Yeah, like any state, me and DK both are based in Karnataka. We have our plants in tier 2 cities. We are able to take care of our employees, their families, or contract labor. But when you go deep into villages, they are thickly populated. That is one. Number two, they don't even understand why do they have to really, wear mask, why it is required, And there are a lot of challenges which we are facing, and that is where we see this time a lot of mortalities, in those areas. Yeah.
And even social stigma to some extent that starts to impact people as well, because behaviors in rural areas are also strongly linked to social behaviors. Let me come to the audience questions now, and I'll take this question to Dr. Pooja. These are very specific questions. So, it might be, let's see how you would like to answer this. So I get this question which says that is HRCT safe? Sometimes patient is asked to go for repeated HRCT. Are there any long-term adverse impact on health due to the same?
See, ideally speaking, we do not recommend HRCT, and that to serial ones for any patient. Normally, HRCT is advocated on day 7 or more if a patient is having symptoms, which is in terms of persisting fever or the oxygen saturation is dropping. And even in our hospitalized patients, we only do a repeat HRCT if there is a deterioration in the patient's conditions. Because per se, if an HRCT is done at the right time, which is usually around day 7, if required, then it helps us to adjust the patient's treatment. But we do not need to do multiple CTs. The majority of the people are actually doing CTs on their own. They'll do one on day 2, day 3, then they'll do one on day 8 and day 9, and then they get upset because there is a progression, which is bound to happen because it should ideally be done on day 7. So when you repeat it, it may show a deterioration. But if the patient is clinically stable and is not having any problems, then there is no need to, because people are so used to and things are so easily available in our country, that you'll have a patient who's done 3 CTs and will come to you, okay, my CT score has not settled. So what people need to understand is that the HRCT score will take time to settle. So normally also we say that unless and until there is a deterioration, it should not be done for at least a period of 4 weeks or so. Rest, Dr. Bharat can elaborate on that, but I feel 4 to 6 is enough.
I think very aptly put, Dr. Pooja, and I think through this platform, it's very, very important. I think it's extremely important to understand that HRCT has its own role in very specific circumstances. So it is, I think, the commonest use is when the patient comes into our hospitals and we want to take him up for an emergency surgery or something where we can't get an RT-PCR report. So that is the commonest scenario where I'll do a CT scan to triage that patient. Even in today's world, we have a suspicion of if you have a pandemic. As of now, if it's a pandemic and the clinical scenario looks like COVID, you don't need to prove it either, because you need to start your therapies and your isolations and your watching accordingly. But you remember, if you need to prove, then the CT scan can give you an indirect evidence in patients who have repeated RT-PCR negative. Okay, these are 2. The third then goes into our hospital domain, where the patients have nothing to do. That's more of a doctor's understanding of how and when he needs a CT, because unfortunately there is no very clear-cut data to show that CT scan-based algorithms actually make any change in the overall mortality or reduction or morbidity in this disease. So as Dr. Pooja said, we only do it to look for other alternative diagnosis, some complications related where we do these CT scans in our hospital. So please, to all the audience and via those audience to their families, please don't jump on and get into a CT scan type of a scene, because there was a scene, I think we all were seeing last 15 days back, but there were queues outside CT scan centers. There was a waiting of like 100 patients to get CT. The second question which you asked was about the problem of getting CTs. So definitely in a city like Delhi, you have low-dose CT scans. So they have been there for, as a pulmonologist, CT scan is our go-through investigation, and most of our patients who come to a tertiary care center. So I'm not that worried about a single CT, but obviously the problem is not getting a CT scan for other reasons, number 1. Number 2, denying a CT scan to a person who would actually benefit from that. I think these are 2 scenarios where don't bother about getting a CT, because this impression may go, because there were certain press conferences which may actually take this impression 3 months down the line, when I want to get a CT scan when the pandemic has hopefully settled, and me or Dr. Mittal or Dr. Pooja writes a CT scan for some other reason, and patient is, oh no, I will get a cancer. So let us not get that portfolio out. The idea is that this time is in unjudicious use of CT scans, both by the patients and by our colleagues. and when they are not required. So I think you can rest assured that in big cities, most of the CT scan machines are now newer ones, which have protocols for low dose CT scans, so which are obviously not very harmful.
So, one thing which comes across whenever I'm listening to all your answers, one thing is very important. I think any medication and any treatment must be followed with the advice of a good doctor and a doctor who is supervising your treatment. I think that is where the telemedication and all the consultation mechanisms that are coming into play, which even ICEMA is opening up for its members, will really help people to guide through this process and having a very systematic approach to the treatment and all that. I would like to come to a little bit to the some questions are there on the side effects of various treatment protocols that are being followed, like steroids, causing diabetes to get worsen, or are there side effects of all these medicines like remdesivir or the new medicines that we talked about. What's the post COVID situation? Someone has recovered from COVID but still has a lot of things to recover from because of the impact of the medication that has happened, or because the body has gone through that. And I can just add to that this latest news about this black fungus because of it's caused, at least on the newspapers talking about the oxygen therapy to some extent causing it. These post-COVID complications, would you like to talk a little bit about that, Dr. Bharat?
Yeah, sure. I think, as I said, because of the easy access to social media now, anything can blow up out of proportion. So obviously, as I said, we all have to take things with all this so-called black fungus is not something which we haven't seen or never bothered about our patients for last maybe 15, 20 years. We have been always seeing these in our patients who have uncontrolled diabetes, who are in sepsis, and we have been treating and managing and trying to find out these patients. Again, because of the sheer number of those patients and sheer number of immunosuppressants being used, as Dr. Mittal said, if you start using drugs, and I think probably you also put it, these are repurposed drugs. They were never meant to be used by intensivists, pulmonologists. We saw sicker patients than over the last 20 years. We never thought about using. It's a very strange type of situation in our medical fraternity also. We are trying to somehow get a feeling of doing something for the patient. I think that's how I will put it. It's like हमने कुछ किया, हमने सब कुछ कोशिश करी. So we are getting everything from rheumatology drugs to oncology drugs, anything which has anything to do with immunity. And I believe that I can't actually explain, but as Dr. Mittal was very aptly trying to tell you, that cascade of inflammation is a graph which, as students, we used to fear, because if anybody asks us something from somewhere, so steroid is a carpet bombing. When you give steroid, it carpet bombs all sorts of inflammation. So obviously you tend to get the burst effect, but the rest are very specific things. So when you start putting them in patients who may not require them, what you're going to get are only side effects. And how and where to put, I think at this time, even the medical fraternity is naive. We have no clue what we are doing for specific patients. It's all that we are evolving and we are trying to probably learn on the job, which is frankly not a very good sign for the patient. If the doctors start learning on the job after 25 years of experience, but that unfortunately is how the pandemic has evolved, and we are trying to do the best we can. So all these infections and secondary infections need to be prevented. But I'll just take a very short, in 1 minute. You will not believe, last year, Dr. Mittal and me were discussing that the number of secondary infections in our ICUs actually fell down drastically. And that was primarily because the healthcare workers and doctors were so afraid going into that. So we were so well protected. I think we were not giving the secondary infections to our patients. So the unnecessary use of antibiotics and so was much lesser. Okay. And as we became confident walking into those ICUs, right, with our vaccine shots and whatever, that there is a sort of a invincibility which sometimes comes when we see those patients day in, day out. I think those and we start using more and more drugs, the chances of secondary infections have grown more and more over especially during last 1 month or so. So I think Dr. Mittal or Dr. Pooja can add something.
No, I was thinking that, there is this term which has been used a lot, cytokine storm, which is what I think we are all trying to manage, cytokine storm.
Correct.
I don't fully understand the term, but I do not know who would like to answer that. But could you define that a bit? And what happens when I understand that COVID leads to cytokine storm in patients, and if it comes in, that is when you really need the very intensive treatment, right? So what is happening in the body when you reach that stage?
I will give you an analogy.
Yeah.
You are driving a car. Someone overtakes you from the wrong side and very rash. There are a number of kind of responses there may be. I will look the other way. There may be someone who just curses. There is someone who opens the window and curses. The third one may just race behind the car, stop that car and run into a fight. Yeah. This is what is happening. If you remember the Second World War, when Hitler walked into Paris, the Parisians refused to respond. So they saved their Eiffel Tower, they saved their Arc de Triomphe, they saved everything because they didn't respond. Similarly, when the virus walks into someone, there will be any kind of responses, right from someone who just looks the other way to someone who reacts very violently. His immune system, somehow, we don't know who these people are, but there are people who respond very violently. Those people who respond violently, they will produce a whole lot of inflammation to the same virus to which someone has not responded at all. So we have a whole spectrum. Once someone has over-responded, someone is chasing the car, stopping it, getting into the fight with a baseball bat, that is the kind of response that someone has shown, and we call it the cytokine storm. What is cytokine?
Unpredictable. You're saying that it's not predictable.
Not predictable, but any patient who is going with high-grade fever beyond 5 days means there is a response going on. Beyond 5 days, someone is going with high-grade fever or someone whose oxygen is dropping. Doesn't mean that is below 94. If someone was maintaining oxygen of 99 and suddenly comes to 95, it's a drop of 4. It's a significant drop. So if there's a significant drop of oxygen or high-grade fever is not getting controlled, these are signs that the body is, a patient is responding adversely to this virus. And doctors become immediately alert to the fact, and these are the patients whom are a candidate for early steroids. Or maybe
just like to extend the session by 8 more minutes. I need to ask questions on vaccination because there's many of them. But before that, one question to Dr. Pooja. I know there is a lot of questions that have come for children, which are not the purpose. We will not go into the depth of it in this one because we're going to have a separate session with a gynecologist and pediatrician in the next series of these talks. But I thought maybe a very generic question. Is there any specific advice would you like to give to parents of young children, in this second wave? What do we look out for? Do we need to do something specific to protect them? Is there anything at a generic level, if you like to take?
See, as you very rightly said, because as in the first wave, children were not affected. So the general take-home message for us was that children were safe. So many a times we come across families when the entire family is affected, but the children are safe. But if you test the children, you may find them to be positive. So when we take precautions for ourselves, we need to take equal amount of precautions for our children also and make sure that they're kept safe because now they're getting affected. And therefore, we need to watch out for symptoms of fever, for cough or sore throat for them also. Because many a times they may not be able to mount as much of an immune response as us, but now this current time, a lot of younger children are getting involved. And that is where, as you very rightly said, that the role of vaccination comes in because as Dr. Mittal pointed out, that COVID is here to stay. It is going to go from one wave to another. So as long as we maintain our behavior as a COVID appropriate behavior and take vaccinations, because most of us believe that vaccination is associated with this complication or that complication. But it's not so because we all have taken vaccination and we know that at least we may get some amount of protection from it and which may save us from a severe disease.
Thank you, Dr. Pooja. Let me come to very specific questions about vaccination. I will not take the most common. There are some very specific questions. So one question I will just read from the chat box here. It says that, can a woman who is breastfeeding take vaccine? This is
Yes.
one.
initially the government Ministry of Health guidelines had said no, but as of yesterday, there has been a statement that all mothers who are breastfeeding can actually take the vaccination because that is for their safety and for the safety of the baby.
That's very specific. And then, is vaccination resulting in blood clotting, or is it? Is there any such evidence that vaccination could also trigger some kind of a reaction in the body, which is similar to the real virus?
Vaccination will. Dr. Mittal is taking that.
No.
Vaccination is actually not causing any thrombosis or clotting.
No.
Yes, as a part of the side effect of the vaccination. Yes, sir.
See, why this all issue came up was for a very simple reason. There is a vaccine from USA, and there were certain subset of people who developed thrombosis following the vaccine given in USA. None of the vaccines available in India, Covishield or Covaxin, till date, we have given almost 160 million or 70 million dosages, not a single. And I am personally aware of at least 6,000 people who have been vaccinated, the healthcare workers with us. None of them has reported what to talk of thrombosis, any kind of reaction, except for, I will add to it, let's be fair, a myalgia fever. Can a myalgia fever for maybe a day or two, which settles very beautifully to a simple tablet of paracetamol. But there is a question which is cropping up now. Can the vaccine cause COVID? See, three kind of people are there, and questions will be there. And we as medical fraternity have a response. That patient went for vaccine and he got COVID. So has the vaccine caused the COVID? One of my relatives asked me this question because he landed up with COVID. The reason is the panic that has now is attached to the vaccination. The centers are overcrowded. There is no point in going for vaccination in an overcrowded center and getting home. Vaccination protection will start after 4 to 6 weeks.
Yes.
COVID, the person will get in next 3 days.
Yeah.
So I will suggest that if there is a center which is showing COVID inappropriate behavior, better not to go over there and get vaccinated. Stay home. That will save you much more than the vaccine today. I'm not saying don't take the vaccine, but don't go to a center which is showing all signs of crowding, overcrowding, and in that case, and the 100 people, odd people who get vaccinated over there, out of that 50 get COVID. So that's not the aim. So this kind of thing is also, this question, can COVID cause, this kind of question has cropped in some other discussion, that can COVID cause, COVID be caused by vaccination? So the answer is this. Yes, it can cause by this inappropriate behavior.
Yeah. Dr. Pittal, another question is really that, the vaccination is not 100% protection against COVID, but vaccination is a protection against hospitalization, severity, and all of that. I think this is the message that we have heard from most of the official communication around vaccination. So how would you like to say that, that would you recommend vaccination in the right, with the protocols that have been communicated, not going to, of course, crowded places, but take the vaccination, the first dose and the second dose as prescribed, stay safe and stay protected, even post-vaccination, even after 6 weeks of vaccination, no change in behavior when it comes to COVID-appropriate behavior?
There are two parts to your question. First part, will you recommend vaccination? I was one of the first people to take it on 16th of January. And my second dose was given on 13th of February. So that should answer the question. Yes, everyone should be vaccinated. That's our only hope of long-term stopping this pandemic. Long-term. Short-term is okay, appropriate behavior. Long-term will stop when we have appropriate behavior and vaccination. And what's the duration between one dose and the other? See, this is a new disease in this sense that we didn't have the vaccination for it. It was made by AstraZeneca and given to our Serum Institute, who mass produced it, right? So this is a new vaccination. We don't really know about it. And as experts are analyzing the results of vaccination which started in our country on 16th of January and started in UK earlier, Covishield was started in UK earlier by AstraZeneca. What is the antibody response? So these recommendations keep on changing from day to day. They have an expert panel, and I know some of them very personally also very well. Dr. V.K. Paul is there. He's a great man, the ICEMA chief. They're very knowledgeable people. And I tell you, behind this vaccine, we should give credit to our scientists, to our industry. Hats off to industry also. You are a part of that industry. Hats off to you. Scaling up vaccination manufacture to this level, making it 90 million a month. This is unimaginable, unthought of in anywhere in the world. I will give a standing ovation to these people, industry people, whether be Serum Institute or Bharat Serum. They have done a great job, and they continue to do great. Dr. Reddy's lab is now coming with Sputnik. They are scaling up the manufacture of Sputnik. So industry, their contribution to control of COVID is phenomenal.
So there is a slightly connected question to this. How long is the effect of vaccination expected to last? There is some talk that one may need to get vaccinated again after 6 months or 1 year. Could the doctors give us some insight on this? Do you think,
I will confuse
we
you.
have the answers to this?
I will confuse you more. Did you get a smallpox vaccination? I got one.
Yes, I did. Yeah.
That's lifetime. That's lifetime.
That was lifetime.
Smallpox is also caused by a virus. Okay, it's a viral disease. One vaccination gives you lifelong protection. And flu shots we take every month, every year. I have been taking flu shots for last 10 years, every year. So we really don't know today that how frequently will it be required, but it will be required. This is the normal take home today.
So we should expect that the protocols may shift as we know more about the disease. So hence, when the recent announcement by ICMR that we are extending the 6 to 8 weeks to 12 to 16 weeks for the Covishield second dose is something to be expected, and more such announcement will continue to evolve as we move forward, I suppose, when it comes to vaccination or the disease or the treatment and all that.
I can tell you one thing, that the recommendations made by the people who are making the recommendations, they have some of the best known best known in the world. So we should not see everything with a very with the political eye. No, the recommendations are made with all sense of sincerity by the group I know very well of. The scientists behind making these recommendations, I believe in them. I have no reason not to believe them. As a doctor myself, as a student of science myself, I will tell you one thing, I have no reason not to believe those people. It may be a good time for TV debates, 5 to 7 p.m. every day. But those are TV debates. Those are for TRPs or whatever. But
those people, sir, another question on vaccination is for those who have actually recovered from COVID. People have recovered from COVID. Is there any duration that should be given before they take the vaccine? Let's say if I'm recovered today, should I wait for 1 month, 2 months before I take my first shot?
The recommendation is very clear. Earlier it was 6 to 8 weeks. Now they have extended it to 8 to 12 weeks because they have no data on the antibody response in these people, for how long they have sufficient antibodies to protect, and the vaccine actually in their case is acting as a second dose. After all, the virus is also giving them a dose of vaccine. This vaccine is dead virus, mounting an immune response. Similarly, someone who has got COVID is protected. Why is he protected? Because he is already vaccinated by the disease, not by the shot, not by the jab, but by the disease. So someone who's protected by the disease, you just need to give him a booster.
You are also connected to all the other activities going on in the country in terms of preparation for the second, third, and all that. Can you just of course, give a little bit of comfort to all of us, all the audience? Would you like to say how is India preparing for the next wave? Are we getting more aware? Are we doing all the right things to be prepared for any next wave? Of course, I fully accept that one of the biggest responsibility lies with the audience, lies with all of us in society to follow the COVID appropriate behavior. But even then, to control a 135 crore people, it's not a easy matter. And then also the level of education, literacy, and all of that. What do you think? Do you feel that from a social understanding the society that we are, do we feel that our preparedness and the initial discussions that are happening will keep us safe in the time to come?
See, if we again learn from our pasts, the normal lifespan of any pandemic is never more than 1.5 to 2 years. We have had plague pandemic, Spanish flu pandemic, we had flu H1N1. Every pandemic has comes with the expiry date. Take my word. So this is to reassure everyone, tomorrow will be better. Don't worry on that count. It will be better. One thing you should understand, that don't take this is going to last forever. Number two, if you enter a dark room, you are very scared of everything. There may be a ghost, there may be a lizard. You switch on the light, everything is okay. So well informed are well prepared. So with every epidemic, every wave, not epidemic, with every wave we have learned. With every wave our learning has improved. And as we learn more and more, doctors become more and more confident and they pass on, dissipate this knowledge. I believe we will be better scientists to control the next wave. Hopefully it's not there, but we should hope for
one last comment, and maybe I would like the response from any of you here on that one. You know, I have in my own relations, I have doctors who are my relatives, and they have been through this pandemic, you know, protected themselves using masks and having a very, very strict protocol on using of masks and while treating patients throughout this period, to the extent that some of them were treating COVID patients. So how, you know, that proves that, you know, the doctors, there are large majority of doctors who have not contracted the disease despite treating these patients at very close proximity. So
the answer is very simple. They are the ones who have the knowledge. As I said, they are the knowledgeable one. We have one person sitting over here. By now, Dr. Pooja Relia must have handled not less than 2,000 COVID admitted patients. Admitted means moderate to severe patients. I see her day in, day out in the hospital wearing that protective mask and whatnot, and working from 8 o'clock till 4 o'clock, not a drop of water, because through that protective mask and everything, you can't even drink water. Yes. So I have seen her working. I think she will tell us her experiences, and they will be eye-opening for everyone, but she has protected herself also.
As very rightly said, the only thing which can save us is our level of protection. So we should not just let down our guard. That is not for doctors alone, it's for all of us. That we need to move back into society. We cannot be in home isolation. We cannot be in lockdown all the time. But when we step out, if we take appropriate precautions, we'll be able to save ourselves. So as doctors, we've maintained that even when the pandemic was easing off or last year wave was easing, we've kept the guard up. So the take-home message for everyone is that even when the number of cases decreasing, you should not let your guard down. Have COVID appropriate behavior and ensure that even if you move out, which is essential, but you take your precautions. And I'm sure with everyone well informed and educated, you all can be safe.
DK, Dr. Bharat Gopal has to drop out. He has some other engagement. So if you could invite him for a last piece of advice from him.
Any closing comments from Dr. Bharat as well?
We discussed with Arvind, this fellow.
Can we mute Dr. Anand Sundar? Yeah. Dr. Bharat, any final comments from your side also as we close off this call?
Yeah, firstly, it's been quite a great experience to hear different perspectives from your side also. And it's great that the industry is actually stepping it because I think the final thing is you can't win over this without awareness. We have been saying this from 30th of January 2020, when probably I did the first program. And problem is that despite doing everything, as you rightly said, it's very difficult to control a class of 50 students in a school, leave about 1.3 billion people in our country. So we'll all have our different perspectives towards life in general. And that's probably what is actually making it very difficult to get them all to stand in one queue, one line, and follow any appropriate behavior. So, but I think if we can't learn now after this second wave, where we have had tragedies all over, it's been a massacre practically, then probably nothing will. So I think with those words, I would request all the people who are that even when we get vaccines, even when we think the pandemic is over, please put another 3 months down the line for extra precautions so that this doesn't come back to bite us, right? I think it's been quite a while. For our sake as healthcare workers, please do it. We have been in the hospital for last almost 1.5 years. So for our sake, if not for your sake, please support us in a way you will support yourself, right? So thank you so much. Thank you, Seema, and thank you, Mr. Sandeep, and thank you, Dr. Mittal, for inviting me. I think it was his brainchild to get this panel together, and thank you, Pooja, for being us. So thank you so much.
Thank you very much.
Final words to close it.
Yeah, thank you very much. In fact, it has been a really great learning experience for all of us, as we know that, all of us have got different kind of questions, queries, and doubts in our mind. And we hear from many doctors, many people, and many times there are very conflicting answers. So today it has been really very eye-opener kind of interactive session, and we're really grateful to all of you. And we would also like to thank all of you for the kind of work which you're doing, helping everybody, working 24/7 and not taking care of, I'm sure you're taking care of your own health. So please continue, and we look forward to hearing from you soon. And our best wishes and our support and cooperation will always be there with you. Thank you very much. Yeah.
Thank you.
To all the very best.
There are few unanswered queries, DK. So if we can put forward to the doctors on mail, if those would be answered, if there are any.
Yeah.
So Seema, what we'll do is that many of the questions I have not taken are linked to some extent with
So in case there are any
and children aspect, we'll take them there, but we might also still take some generic questions in our next series. So I will request everybody, those who joined us today, to look out for the next one, and we will be out with it soon, and I'm sure we'll take more questions in the future. Thank you.
Thank you.
Thank you
to Secretariat, ICEMA Secretariat, to arrange this. Really, please continue with this. Yeah. Thank you very much.
Thank you.
Thank you.
Stay safe.
Thank you.
Thank you. You too.
Thank you. Thanks to everyone.